Welcome to Florida State University. This is an overview of the insurance options and additional perks available to all faculty and staff employees. If you need assistance with enrolling or making changes to your insurances, log onto the People First website or contact them at the phone number listed on this slide. Otherwise, you can contact the Human Resources Benefits Office. People First is the administrator for all insurance benefits offered by FSU. Their responsibilities include determining eligibility, processing enrollments, handling qualifying event changes, verifying dependent eligibility, COBRA, and open enrollment. You will use the People First system to enroll into and make changes to state benefits. You can do this online or by telephone. You have 60 days from your hire date to enroll. The earliest your health insurance can begin is the first of the month following your enrollment. For example, if you are hired and enroll in August, then the earliest effective date for your health is September 1st. Your supplemental insurances become effective the month after 2 full checks in the same month have occurred. For example, if you are hired and enroll in August, your supplemental plans will begin in October after the 2 paychecks in September have deducted premiums. Premiums are paid the month before coverage is effective. If you are eligible for benefits, People First will mail login information to your home address. You can contact the People First Service Center or email the Human Resources Benefits Office to receive your login information. You can obtain your People First user ID before receiving your packet in the mail from People First. The Benefits tab in the My FSU portal provides you with your People First user ID, a link to the People First website, and will list any current enrollments that you have. You can also email the HR Benefits section to request your user ID. This will enable you to enroll and secure the earliest effective dates available. Qualifying status changes are specific life events, which can occur at any time that allow you to make changes to your benefits. You must notify People First within 60 days of the event, or you will have to wait until open enrollment to make changes. People First may also require documentation to verify the qualifying event and process your request. There is an annual open enrollment period that gives employees an opportunity to review and/or make changes. This period is usually during the fall, and all changes go into effect on January 1st of the following year. Prior to open enrollment, People First mails information to advise employees of their current benefits and to provide information about any upcoming changes. The default password to log on to the People First website the first time is uppercase P, lowercase f, followed by your date of birth, 2-digit month, 2-digit day, and 2-digit year. Select the Change My Benefits link to enroll or to make changes. Standard health insurance plan premiums are the same whether you choose the PPO or HMO option. An employee who has a spouse that works for the university or another state agency and is also benefits eligible can enroll into the spouse program and receive health insurance at a reduced premium. Positions hired for less than 30 hours per week, an FTE below 0.75, pay a pro-rated premium that is higher than what is listed on this slide. Contact the People First Service Center for rates. In general, HMO plans focus on wellness, prevention, early detection, and the treatment of illnesses. These plans do not have pre-existing condition exclusions, claims to file, or any deductibles. You may need a referral from your primary care provider if you need to see a specialist for a specific concern. Services are limited to the HMO network unless referred. However, you are fully covered worldwide for emergency services. The PPO health plan offers the widest range of available physicians and allows members to self-refer to specialists. Services are not covered until annual deductibles are met. Once these deductible amounts have been paid by the member, the plan provider begins paying the percentage of costs for medical and prescription expenses. The deductible varies based on whether the provider is in the network. Check to see if your provider is part of the network before you receive services. Otherwise, you may have to pay more than you expect. FSU offers the option to enroll in an HMO or PPO high deductible health plan, or HDHP. With HDHP, you must meet a higher annual deductible, but your monthly premiums are lower than the standard plan premiums. You must meet the annual deductible amount for all services and prescriptions, except certain preventative services, before the plan starts paying toward your expenses. The HDHP offers the option to open a health savings account. The university will make a contribution towards this account, even if you choose not to make additional contributions. You must open an account online with Chard Snyder through the People First website. A health savings account is a pre-tax account used to pay for qualifying healthcare expenses. The funds can accumulate over time. You can use the remaining balance for eligible expenses if you change health plans or leave state employment. You will receive a prescription card in addition to your health insurance card. Members may obtain prescriptions at either a local pharmacy or through the mail order service. Most pharmacies accept CVS Caremark. However, Walgreens does not. Medication synchronization is available for you to use one time each year. This enables your pharmacist to synchronize all of your medication refills so that you can pick them up on the same day. PPO plan members must fill maintenance medications through mail order or at a participating retail pharmacy. A list of maintenance medications can be obtained from the provider. HMO plan members may use the 90-day mail order option to reduce prescription costs. Questions about your prescription drug costs, available generic alternatives, specialty medications, mail order, or locating a network pharmacy can be directed to CVS Caremark. Flexible spending accounts allow employees to set aside pre-tax dollars to cover medical independent care expenses. Your elected amount will be deducted from the remaining paychecks for the year and renews automatically for the next year unless you change it during open enrollment. The healthcare and limited purpose accounts allow you to roll over up to $500 to the next calendar year to use. The dependent care account funds are use it or lose it. Please note, if you are enrolled in a high deductible health plan with a health savings account, you are only eligible to enroll in the limited purpose FSA.
There are 3 ways to save with benefit options that allow you to shop for healthcare services, earn tax-free financial rewards, and reduce out-of-pocket healthcare costs. These benefits are designed to save the state money and allow you to share in these savings through Healthcare Blue Book, Surgery Plus, and Chard Snyder. Healthcare Blue Book offers an online transparency website for employees to shop for healthcare services, facilities, and providers. This voluntary benefit rates providers and facilities based on cost and quality. Using this service can earn you a financial reward. Surgery Plus is a voluntary benefit that provides non-emergency surgical services. Surgery Plus is separate from your health plan and is able to bundle services together to reduce costs and provide you with a financial reward. Chard Snyder is the administrator for the Health Reimbursement Account, or HRA. This pre-tax account can be used when rewards are earned to reimburse you or pay for eligible medical, dental, and vision expenses.
A $25,000 basic life insurance benefit. The premium is paid by the university for full-time employees. All full-time employees are automatically enrolled into the plan. Part-time employees must elect the coverage with People First and will pay a pro-rated monthly premium. Optional life insurance is an after-tax benefit available for additional life coverage for up to $1,000. You can enroll in 1 to 5 times your salary, or up to $500,000 without proof of good health. When enrolling in 6 or 7 times your salary, or to insure above $500,000, then proof of good health is required. Employees pay the entire optional life premium cost. Both the basic and optional life insurance policies include death and dismemberment coverage. Coverage is available for spouses and eligible dependent children through the state's spouse and child life insurance policies. 2 tiers of coverage are available for the coverage of your spouse. If your spouse works for another state agency or university, then the spouse life coverage is not available. Child Life provides a $10,000 death benefit and is 85 cents a month, regardless of the number of dependents added to the coverage. There are 4 different dental plans available to FSU employees: prepaid or HMO, PPO, indemnity with PPO, or indemnity. Providers may drop out of the plan at any time. This is not a qualifying event to change plans. So, be sure to verify that your dentist accepts the state dental plan you're considering. Plan brochures and contact information are available on the state's My Benefits website to compare policies and monthly premiums. Prepaid dental plans maintain affordable premiums and low out-of-pocket expenses through a network of participating general dentists and specialists. If you use a dentist that is not part of the network, you will have to pay the entire amount for services received. You cannot change dental plans based on provider preference, except during open enrollment. PPO dental plans allows you to receive care from the dentist of your choice. You will pay less by staying with the PPO network. The annual deductible must be met before the plan starts paying benefits. The indemnity with PPO plans allow you to visit a dentist of your choice. The PPO covers a percentage of cost based on the service received for both in-network and non-network providers. The indemnity plan allows you to select the dentist of your choice. The plan pays a set amount for covered services, and you pay the remaining balance. Be sure to inquire about the charges before receiving services. Premiums and dental companies are available on the People First website when you make your elections, or through the plan provider benefit brochures located on the state My Benefits website. You can receive an eye exam with your health insurance coverage. Vision insurance is separate from health insurance and offers coverage for eye exams and materials. You are eligible to receive an eye exam once every 12 months. Within a calendar year, you may only have the material benefit towards either contact lenses or eyeglasses. There are several companies that offer supplemental hospital, cancer, short-term disability, and accident insurance. This coverage is independent of health insurance. Contact the individual provider company for more details. Enroll with People First and complete any separate applications of insurability before the coverage begins. FSU has other programs that are offered to employees on an after-tax basis, including additional life insurance, long-term disability insurance, long-term care insurance, accidental death and dismemberment insurance, and critical care insurance. These plans will be discussed in greater detail in just a moment. Employees are guaranteed coverage in most cases when enrollment occurs during their first 60 to 90 days of employment, depending on the coverage. Contact the provider for policy information and enrollment forms. There are a variety of life insurance plans available to FSU employees, their spouses, and dependent children. Please contact the Gaber Agency for rates and enrollment procedures. Group Whole Life Insurance provides a benefit up to 4 times the employee's salary, with a maximum of $250,000. Offered simplified issue to employees and spouses during the first 90 days of employment or during special open enrollments. Group term life insurance provides a benefit up to 4 times the employee's salary with a maximum limit of $200,000. Offered guaranteed issue to employees, spouses, and dependent children during the first 60 days of employment during special open enrollments. Term life insurance provides a benefit with premium costs determined based on the insured person's age or gender. The benefit is fully underwritten. Long-term disability insurance covers supplemental income should you become disabled and unable to work. Benefits are paid at a rate equal to 60% of your gross monthly income prior to the disability. Disability benefits will start on the 31st or 91st day of disability. Depending on the option chosen, the employee must be unable to work for 30 or 90 consecutive days. Offered guaranteed issue to full-time employees for the first 90 days of employment. After 12 consecutive months of disability, the employee will receive a 2% cost of living increase up to 5 years and an annuity benefit. Premiums are based on the employee's annual salary and a rate factor. It does not cover any disability which begins in the first 12 months after the effective date of coverage, resulting from a pre-existing condition occurring 3 months prior to the effective date. Long-term care is the type of assistance you would need if you become chronically ill and unable to handle some of the basic activities of daily living, or if you require substantial supervision due to a cognitive impairment. It can help you stay independent for as long as possible, enabling you to receive care in the location you choose. This can be in your home, community adult daycare center, hospice care facility, assisted living facility, or nursing home. Long-term care coverage is available with a group discount to all full-time employees, ages 18 through 64. It is fully underwritten by Unum, so a medical exam may be required. Accidental death and dismemberment policy is available to full-time FSU employees. This coverage pays a cash benefit directly to the employee for a covered accident or dismemberment. Coverage is available in $1,000 increments up to a maximum of $350,000. Coverage is guaranteed issue at any time for full-time employees, meaning no medical exam is required. Enroll through the Standard Insurance Company. Critical illness insurance provides financial assistance to offset loss of income incurred from treatment, expenses related to travel and lodging, out-of-pocket medical expenses, and rehabilitation expenses incurred by critical illness. Critical illness insurance is offered guaranteed issue, meaning no medical exam required, to new hirees for up to $15,000.
U.S. Legal provides legal services and identity theft coverage through payroll deduction to FSU employees. There are 2 coverage levels available to enroll into: the Family Defender and the Identity Defender. These can be enrolled separately or combined. Click on the slide link for information or to enroll.
You have 60 days from your hire date to enroll into state benefits. Your next opportunity to enroll is open enrollment. Contact People First for your ID and to enroll into benefits. Faculty premiums are doubled during the spring semester. This provides coverage through the summer months. Summer appointment paychecks will not have insurance premiums on them. Contact the Human Resources Benefit Office if you are hired during the summer. You may need to submit premium payments directly to People First. Florida State University offers employees additional perks. Some are available through payroll deduction or direct pay. The Florida Prepaid College Program is a great way to save for your child's future tuition while locking in today's rates. Several tuition and dorm plans are available for use at universities, community colleges, and private colleges. The College Investment Plan allows employees to invest pre-tax dollars to withdraw and use for college expenses. Full-time salaried employees can take advantage of 6 free credit hours each academic term at FSU. Courses are for degree or non-degree seeking students, regardless of job relevancy. The employee is responsible for the cost of books and additional course fees. Visit the Human Resources website for additional information, course exclusions, and the application you will need to complete. The Seminole Savings Program provides discounts to employees. Visit the HR website for the list of vendors. Please contact our office if you have any questions or if you need assistance. Thank you.